The Northern Forest Canoe Trail is kind of like the water version of the Appalachian Trail. It's 740 miles from Old Forge through the Adirondacks, across Lake Champlain and into Vermont, New Hampshire, ending in Maine. It's the longest contiguous inland water trail in the United States. Just a handful of people paddle it end to end. It's not like the thru hikers of the Appalachian Trail. But thousands of paddlers enjoy pieces of it, and they need campsites and put-ins and carries. We'll meet a crew that helps maintain all that outdoor infrastructure on today's Story of the Day.
Support for Story of the Day comes from Long Run Wealth, an SEC-registered investment advisor in Lake Placid, providing comprehensive wealth management, retirement, and financial planning solutions. LongRunWealth.com.
Hey, I'm David Summerstein. It's Wednesday, December 18th. First up, about a year ago, Claxton-Hepburn Medical Center in Ogdensburg announced plans to split into two facilities. One will become a critical access hospital managed by Carthage Area Hospital. Those changes came to fruition earlier this fall. Amy Feiereisel has an update on what that looks like and what it means for patients.
If you visited the Claxton-Hepburn Medical Center in the last 6 weeks or so, you may have noticed some changes, some new signs. The Claxton-Hepburn Medical Center now refers to a standalone mental health hospital.
And all of the acute services, primary care, ER, anything else that's outside of mental health is now called Claxton-Hepburn Medical Campus, and that is operated and managed by Carthage Area Hospital.
That's Jessica Boline, a spokesperson for the North Star Health Alliance, which includes Claxton-Hepburn and Carthage Area Hospital. Boline says initially there was a lot of confusion about the change.
And even unsettling for a lot of the community because they thought, oh my gosh, it's closing, it's being taken over. That word merger kept going around.
The hospitals made this deal for Carthage to start managing all non-psych services in Ogdensburg last year because Claxton-Hepburn was in over $30 million of debt. In this new configuration, revenue from the mental health hospital and lease payments from Carthage Area Hospital will help pay off that debt. For the public, Boline says most of the change has happened behind the scenes.
So all the doctors are the same. All the employees are the same. Nothing has changed really other than the name and the signage that is in that part of the facility.
Health clinics in Ogdensburg, Canton, Madrid, Hammond, and Waddington are also now under Carthage Area Hospital management. Part of Carthage's takeover was the intent to turn the new Claxton-Hepburn Medical Campus into a critical access hospital. That's a federal designation which allows rural hospitals to get better reimbursements and other benefits.
So this critical access designation helps us to, preserve services, preserve jobs, and it sets conditions for us to grow and to keep offering the services that we currently offer.
Over the last 20 years, North Country hospitals and healthcare providers have had to change the way they run to stay afloat financially. Many have joined up with larger regional networks like the St. Lawrence Health System affiliating with Rochester Regional Health, or CVPH in Plattsburgh joining the University of Vermont Health Network. Claxton-Hepburn is part of a more localized area network called the North Star Health Alliance. It's been around since 2015 and currently consists of 5 healthcare providers that share resources. Boline says what that looks like in practice is a patient in Ogdensburg needing a hip replacement.
And the ideal surgeon for her was a North Country orthopedic group surgeon. So rather than making this patient drive all the way to Watertown, have the procedure, drive back, because you're in pain, recovery and all that.
Instead, that surgeon traveled to Ogdensburg and did the surgery there.
The patient did not have to travel. The provider traveled. So that's just one example of how we're really trying to offer these services locally and not have to send people to Syracuse or Utica or Rochester.
The North Star Health Alliance includes 5 healthcare providers in St. Lawrence and Jefferson counties, and a new group joined the alliance recently.
So we'll have 5 more pediatricians within our system, which is very exciting.
North Star Pediatrics will be opening in Watertown in January, and Claxton-Hepburn Medical Campus should receive its official status as a critical access hospital not long after. Amy Feiereisel, North Country Public Radio.
The Northern Forest Canoe Trail, the nonprofit, sends out trail crews all summer to improve campsites and canoe carries along the route and attract more paddlers to the water. I caught up with one crew over the summer outside Saranac Lake. Let's go there. When I show up at a popular campsite in the Second Pond Channel, Ethan Campbell, an intern from North Carolina, is sweaty and dirty and grunting, barreling a loaded wheelbarrow through the thick woods.
So we are wheelbarrowing a ton of dirt to the new tent site. Yeah. Sorry.
It's hot and humid and buggy. Campbell delivers the dirt to a tent site that's been eroded from use. That's where fellow intern Aviva Elliott from Albuquerque, New Mexico is working, pounding the dirt down with a metal tamper.
Right now we're just filling in the tent pad that we dug out to mineral soil underneath the duff layer. And now we're just filling it in with other dirt that we're taking from a borrow pit far away. A lot of hard work. It's quite warm.
Trail crew lingo translation. They're building a more comfortable campsite for paddlers that's also more environmentally sustainable.
A lot of the time, tent pads will be in sort of shallow grooves or depressions, and those can fill with water, which is not pleasant if you're camping in a rainstorm.
Assistant Trail Director Alex Delhagen says they look for improvements all along the Northern Forest Canoe Trail, from the Adirondacks to Maine.
Maybe paddlers report it, or when we're out in the field doing site visits, we notice that something is in rough shape and needs to be fixed up. Or we identify an opportunity for a new access project or a new campsite, for example, and work with them, reach out to the DEC or reach out to Fish and Wildlife and develop the plan together with them.
This summer, 2 trail crews finished 16 projects along the route. This one is the roving crew. Joining Delhagen and the 2 paid interns is Lena Gravenhorst from Leipzig, Germany, who signed on as a volunteer while backpacking around the U.S.
Originally, I wanted to volunteer on a farm and then later find a place where I can kayak or canoe. And then I found this place and I was like, wow, I can do both at the same time. I love it.
From June to August, this crew rebuilt campsites on Valcour Island on Lake Champlain. They installed stone steps at a new put-in on Vermont's Missisquoi River. And they built a floating dock at the Five Foals lean-to on the Saranac River. The whole idea of a Northern Forest Canoe Trail started to coalesce in the 1990s. It was a time when these northern northeast states were going through a transition. NFCT current executive director Carrie Thomas says the founders of the trail saw logging and paper mills that were the backbones of small towns going out of business.
It was really clear that the forest products industry was in decline, and a lot of the communities along our route were suffering and didn't have any clear path forward from an economic perspective, and they, kind of ahead of their time, saw outdoor recreation as a potential economic driver.
The nonprofit group Northern Forest Canoe Trail formed in 2000 to essentially build a trail from a collection of rivers and lakes, using traditional indigenous travel routes as a guide. The NFCT worked with private landowners to grant access to the rivers and streams along the trail. And it produced maps and guidebooks to attract paddlers to the water and the communities near it.
Helping people kind of discover the area to start with, inspire them to think about wanting to paddle here, and then providing them with the resources that they need to plan those trips.
We boat down the Second Pond Channel to another project this trail crew is working on, the canoe carry around the lower locks of the Saranac chain. Delhagen explains the trail here is steep and rutted and eroded.
And that makes it tricky for people who are walking along the slope, especially if you're carrying a boat. And in the past, we've had a problem with people slipping off the side. And some people try to go up and around it, and some people go below it, which is not sustainable and makes the problem a bit worse.
By the end of the summer, the crew will have this canoe carry sloped and graded for better runoff and covered with gravel for easier walking, which is a big deal because every fall, hundreds of paddlers run up this trail as a part of the 90-miler canoe race. That's another way the NFCT nonprofit has been promoting the trail. It now runs the 90-miler and 4 other paddling races, attracting hundreds of people and thousands of dollars. NFCT Director Carrie Thomas says this work balances environmental stewardship and economic growth.
If the people don't come and paddle here or people don't come and hike here, then they're not going to fill up the restaurants. They're not going to stay in the lodging.
The goal, she says, is to keep rural Northeast communities vibrant and the water and land around them sustainable, and so paddlers can keep paddling. David Summerstein, North Country Public Radio, on the Second Pond Channel near Saranac Lake. It's me again, back in Story of the Dayland. Music today by Alan Dunham of South Glens Falls and Caitlin Scholl of Lake Placid. I'm David Summerstein, North Country Public Radio.